Around 160,000 people every year have either their hip or knee replaced. Now think about it, that's enough people to fill Wembley Stadium twice over. And you know, these are the most successful operations in modern medical history. Around 80% of our patients go home within 3 days.
Hello Mary, come and sit down.
Thank you.
And the key to that success lies in the medical team and the patient working closely together.
These are your x-rays and they...
As a patient, you have a key role to play in making sure the outcome is exactly what you want it to be.
I think the patient's role is integral to the whole process. It's very important both preoperatively and postoperatively. I think if patients can make themselves as fit as possible before the operation through stopping smoking, through weight loss, it makes the risks of the operation significantly lower. It makes their ability to rehabilitate but afterwards much better. And the whole process is much more satisfactory for the patient, nurses, doctors and everyone involved in the whole process.
So now you've been listed for a hip or knee replacement, there are a few things we want you to do to help us, to help you. Look after your health. If you get skin ulcers or infections, see your GP. It's also a good idea to visit your dentist for a checkup to ensure you have no infections. We don't want to cancel your operation. Keep as fit as possible while you're on the waiting list. Take painkillers if you need them, but stay mobile. Stop smoking. If you do smoke, you're at greater risk of complications after the operation, and the time it takes you to heal increases. If you're overweight, try to lose some of that weight. Your GP can help with a weight loss programme. And make plans now for the day you're discharged from hospital. For a start, have you arranged a lift home?
Why do I need this operation now?
How long will I be in hospital?
What sort of anaesthetic am I going to have?
How will I manage at home?
When will I be able to drive?
What type of joint will I have?
Of course, we know there are loads of questions swimming around in your mind as you wait for your operation. Perhaps the most common is, how quickly will I recover? When will I be mobile again?
Well, the short answer is much quicker than you think. If you have your operation in the morning, then you'll be up and standing on that leg that afternoon.
Just come through and take a seat.
Now, some of these questions will have been covered at the pre-op assessment clinic, or POAC as it's known.
Yes, I've had the other.
The main aim of POAC is to assess whether you are medically fit for the operation. Among other things, your blood pressure will be checked. You'll already have been given this booklet, your hospital passport, which will answer many of your questions in a bit more detail. So what about the operation itself? Well, whether you're having a hip or knee replaced, you'll be part of what's known as the Enhanced Recovery Programme. Now, everything we do and the way we do it will be driven by the desire to get you back on your feet and home as quickly as possible. And that begins with the type of anaesthetic used. Here at Musgrove Park, most patients have a spinal injection which makes you completely numb from the waist down during the operation. You actually don't need to be asleep during the surgery, but most people prefer some sedation.
In our experience, doing a spinal is just a very good way of providing a safe and comfortable anaesthetic for the patient. I mean, what we basically do is we use a very, very thin needle to inject local anaesthetic into the spine, and what that does is make the patient completely numb from the waist down. And so during the operation, because you can't feel anything, we don't need to provide a true general anaesthetic, and we can avoid strong painkillers. So when the patient wakes up after the operation, they're completely pain-free and they don't have the side effects such as sickness.
Your operation's all over and you're in the wake-up room now.
Once you're awake, it really won't be long before we start getting you mobile again. The important thing to remember here is that you are not unwell. You are on the road to recovery.
And then we're going to stand up and then transfer around to the frame.
Whether you've had a hip or knee replaced, our aim will be to get you out of bed a few hours after your operation once you feel your legs again.
So when you're ready, have a stand.
Mobility really is the key to a swift recovery. lying still isn't the answer. To begin with, this will be with our physiotherapists or trained nurses. We'll normally get you walking with a frame to start with.
So we're going to walk out.
Then gradually we'll try to progress you to crutches or walking sticks.
And then your operated leg up and follow.
And if you need to, you'll be assessed walking up and down stairs. As your mobility progresses and you become more confident, it's something that you can do with your relatives or friends when they visit. Remember, all mobility is part of your road to recovery.
Okay. And when you walk.
Mary had 2 hips replaced in the space of 6 months. On each occasion, she made a good recovery.
It was pretty good, really. I suppose it took me about 10 days or so to feel completely independent. But I mean, I've got chickens right down the bottom of the garden, and I was able to go up and down to open and close the chicken house after a week or so without worrying about it. Yes, I got back to independence around the house and garden very quickly. I think being prepared has to be very important, because particularly one of the problems is not being able to drive for 6 weeks. So I made sure that I had a freezer full of stuff that I could cook easily, because you can't be phoning your friends up every day to say, do you mind bringing me something? And also to make sure they were things that were easy to cook, because standing for long periods in the kitchen was a bit uncomfortable.
And home really is the best place to be. Evidence shows prolonged hospital stays increase the risk of complications such as blood clots and infections. John is another patient who surprised himself with the speed of recovery from his hip operation. He was out cutting the grass after 3 months.
First and foremost, obviously, I got out of bed pretty quickly and was discharged from hospital within 2 days. But I think the biggest criterion of all was when I came home to find, for the very first time after a very, very long time, I could walk up the stairs. Actually, 1 stair at a time with each leg, whereas for some considerable time I've been dragging my left leg up. Now I could actually walk up.
Come on, where are you?
It's the same for almost everyone. Before you know it, you'll forget you ever had an operation. And that's the way it should be.